We provide excellent quality care at Archbold. Even though we may be a small town, we have excellent care providers, excellent staff.
It's important for us to provide that high quality of care to our patients so they know that they are in the best hands possible.
You can have the same outcome at Archbold, if not a better outcome, as you can at a bigger hospital.
This is Archbold helping our community to survive and to grow.
I think that it just really demonstrates the fact that Archbold is caring, and it cares about the people in the community, and that it wants to give back to the community. It's important because there's so many people out there that would not be able to get screened for cancer, high blood pressure, diabetes, high cholesterol, or any of these things if it was not offered free.
The healthcare environment is constantly changing, and I think Archbold is trying to plan ahead and stay ahead. We've seen changes that have occurred in the physical structures, including the inpatient facility. We've seen changes in terms of outreach clinics such as Bainbridge's multi-specialty clinic. And we also have this new primary care facility.
It's pretty important to have growth in those areas so that the community and the patients will feel comfortable coming there to get the help that they need.
When I also think of growth, I think of the changes that occur in terms of the services that are offered. We have training and personnel that have changed over the years that have enabled us to offer services from a medical standpoint that gives us the opportunity to provide services locally that we might have sent people off for previously.
I have been here 10 years. There's nowhere else I would go, and that's a lot to do with the people I work with.
I'm proud to work for an organization that has a sense of family.
It's really gratifying when you receive a handwritten, detailed thank you note from someone who is outlining, something out of your basic job description, but they tell you how how it made their job so much easier and so much better.
I have felt that Archbold's always let me grow, whether it's grow professionally, grow in what I can do in my job.
When my boss looks at me and she tells me, you know, thank you for your hard work, thank you for all these long hours, and she says it sincerely, and she tells me that she wouldn't want to do her job without me, it's a big deal.
I like that I can be involved in cutting-edge technologies, cutting-edge services that we can offer in this area. So that pride of me working at a place that's doing great things, that's always been important.
And it's very rewarding when you go to the waiting room and you're able to tell that family member, you know, their loved one's going to be okay. You can almost see the sense of relief come over their face, and you can sense the joy and happiness, and that makes it worth it time and time again.
Financial stewardship for me and the area of surgical services means coming to work, working around great people, knowing that we're trying to eliminate waste, be more efficient, and providing excellent health care to our patient population.
We have to manage ourselves so that every day, every department can run as efficiently as possible.
But the ultimate goal is to achieve what's needed for our organization and, most importantly, the patients of our community.
You want them to come back and say, you know, I had my surgery done at Archbold and my healthcare team was amazing.
It makes you feel better to know that the nurse actually cares and you're not just a number on the board. You're actually a person to them, and they really want to see you get better.
It feels really good when I know that a patient has had a good experience and I've taken care of them, and I can say, you know, I had a part in that.
We want them to feel like they're loved and cared for, and if I was in their shoes, then I would want somebody that felt the way I did about my patients, that treats them like family. Whenever somebody goes through the hospital door to me, they become my grandma, my grandpa, my sister, my brother, and that's just that's important to me.